During the pandemic, the Biden administration was repeatedly claiming that it was following the science and listening to the experts. But looking back, it's clear that they really got a lot of things wrong. And it doesn't look like they were following the science, maybe science fiction. They were ignoring, they ignored the data. And in fact, there's now evidence emerging continually that they kept data out of the public eye that did not meet with their narrative. Well, now the Biden administration is looking to bring back masks and jabs as the what I call the election variant of COVID is now emerging. Even though we know all of these things were ineffective and unnecessary. So has this administration learned anything from its missteps during the last pandemic? Has the medical community learned anything? Well, here to discuss this is Dr. Bhattacharya. He's a professor of medicine at Stanford University. He's also one of the authors of the Great Barrington Declaration, which advocated for an alternative approach to COVID at the very beginning and was criticized by the left. Of course, he and others have since been vindicated. Dr. Bhattacharya, thanks so much for joining us today. Great to have you back on the program.
Thank you for having me, Tony.
So let me just start with this question. Have we learned anything from what we did last time?
I mean, I would love to answer yes, we have, but unfortunately, it just seems like we are trying to make the same mistakes again. I think with mask mandates, with essentially recommending boosters before we actually have high quality randomized data, ignoring the fact that the population has very broadly has quite a bit of immunity thanks to recovery from COVID. And, we just basically we're like, so, and I hear we're closing, some schools have been closed again. I think that the idea that what failed before will work now is an amazing thing to me. Science normally learns from its mistakes. In fact, that's how science actually works: is you make a mistake and you change your hypothesis, and then you test that next hypothesis. Here, what we see is the opposite of that. It seems like we're just doomed to repeat ourselves over and over again, Tony.
With all of the money that the government has, all of the studies that they do, have there been any studies that have gone back and looked at the effectiveness of masks, the vaccines, the shutdowns? I mean, have we really analyzed this to look at what would be the best practices going forward in the future for the next pandemic?
That is absolutely vital. There have been some studies. So, for instance, on masks, there actually have been a dozen high-quality randomized studies before the pandemic, and several during the pandemic that tested whether mask mandates and masking works. And they failed to find evidence that it does. On lockdowns, there's, again, dozens and dozens of studies comparing places like Sweden, which did quite well without the lockdowns, versus other places, and concluded that there really isn't a purpose for the lockdowns that we followed. School closures, again. But what hasn't happened is an official inquiry, kind of like a 9/11 commission or what happens after any plane crash, right? You have the NTSB come in and do an analysis. The goal isn't to blame anybody. The goal is to learn lessons from what went wrong so we don't do it again. I wrote something called the Norfolk Group document along with 7 other scientists, where we lay out an agenda for an honest COVID commission, 80 pages of questions that I think really deserve answers on vaccine efficacy and side effects, on mask efficacy, on lockdowns, lockdown harms, school closures, why immunity after COVID recovery with natural immunity was ignored. All these questions I think that people deserve an answer to, and yet there doesn't seem to be any official interest on the part of the Biden administration to actually conduct such an inquiry.
My recommendation would be that I don't care who's in charge, whether Republicans or Democrats, that is a good idea, because I think one of the things that suffered the most is the trust in government, given what has happened. And now the evidence that continues to come forward. I was just reading an article from Epoch Times about analysis of vaccinated seniors and how their cases soared in 2021. The CDC, the FDA had this information, but they hid it from the public. This was a government study conducted by the military. They're hiding information. You were silenced. I mean, there's now evidence in a court case that you were targeted in social media to be silenced. I mean, the government has lost trust. The American people have lost trust in government.
I mean, that story is really shocking, Tony, because what that story says is that the CDC had information from an analysis of Medicare data, which is Medicare's, the insurance program that covers elderly in the United States, that the vaccine was waning in efficacy in September 2021. That meant that there were a large number of seniors that were relatively unprotected by the Delta wave that was hitting the South back then in 2021. It was right around that same time the Biden administration pulled the allocation of monoclonal antibodies to the American South, claiming that they wanted to save it for later. A lot of people died as a consequence of that hidden information. If the CDC had shared that information more broadly, then we might have been able to protect those older people during that deadly Delta wave. It's funny because even the FDA, there was an email in that came out where the FDA itself was blindsided by that CDC data. They were shocked that the CDC hadn't shared those data with them, that the Biden administration hadn't made this available more broadly. And the reason was very simple. They thought that if they told people would stop taking up the vaccine. But data like that, scientific data like that, are a public good. You don't use it for propaganda purposes. You use it to tell people true things, and so that people can make good decisions. And that was a major failure, I think, during the pandemic.
Just again, a lack of trust, I think, going forward. I mean, there's a lot of things I listened to going into that first pandemic that I won't this time. And I think there's a lot of Americans that would say the same thing. Final question for you, Dr. Bhattacharya. So what's the best prevention for this election variant of COVID?
I think for most people, just live your life. I think that COVID, because people have immunity. I mean, immunity is a honest to God, real thing. You should just live your life and don't worry so much. Now, if you are older and you have or vulnerable in other ways, go talk to your doctor. There are better treatments now available. The vaccine might be necessary. I wish there were better data in order to guide doctors around this. But the point is that we should not be treating COVID as something around which we reorganize our entire life.
Right.
We should instead be treating COVID as something that's manageable, and we should do that.
Just like the flu. We've got to continue to live our lives. Good recommendation there, Doc. Great to see you. Thanks so much for joining us.
Thank you.